I'm Marianne Martindale. I'm the Executive Director of the Utah Academy of Family Physicians. Thank you all for joining us tonight for our first ever virtual annual meeting. So bear with us with any potential technical aspects. Before we begin, I just have a couple quick announcements. First, we will be muting everyone who joins the call. Please do not unmute yourself unless you are a scheduled presenter or a participant. You can feel free to make comments using the chat feature, but we're not going to be interrupting the presenters and want to ensure that the program's free of any kind of outside noise. I want to acknowledge and thank Barb, our program director, who's handling all the technical and put together all the slides and everything. And I also want to give a special shout out to Betsy Boyd Flynn, the Executive Director of the Oregon Academy of Family Physicians, for graciously assisting Barb tonight doing our running our back-end technology stuff. For the best viewing, we recommend switching your screen to speaker view. That's typically found in the upper right-hand corner of your monitor or of the screen. And with that, we will begin. And we will begin by welcoming Kyle Jones, who is our current president, soon to be immediate past president, and he will start the meeting.
Hello to everybody. Thank you so much for participating. I know that these circumstances are unusual, but obviously the health and safety of everybody is paramount. So thank you for joining, but also thank you for all you do every day. With it's tough enough just being a physician in regular times, and now dealing with all of these issues makes it even more challenging. So thank you. Just a couple of comments. So for the last year, one of the biggest things we've wanted to focus on is sharing our story as family physicians, as providers who see all sorts of patients. And the great thing is that we've actually seen a lot come of it. I know a lot of physicians in different areas of the state that have been talking more and more to their legislators, who have been submitting articles to newspapers, who have been participating more proactively and more vocally. You know, as a state academy over the last year, and this is largely due to our staff, Marianne Martindale and Barbara Munoz, who do a great job, we've been able to have much more of immediate impact from the family physicians of Utah. We have had multiple articles in the newspaper, both op-ed articles as well as those that have featured the UAFP prominently on various topics. We have been able to have Marianne Martindale and Dr. Noyes, who will become the president later today, and myself interviewed on radio stories. And even just in the last couple of weeks, we've had multiple organizations of other specialists in the state that have come to us to get some guidance on some different things and want to work more closely together because of the way that we are leading out. And I want to thank all of you for that, for being the family physicians that you are, for taking care of your patients, for taking care of yourself. And I hope that we can keep that going in terms of being vocal, being bold, and really being the family physicians that we all set out to be. So thank you for being here tonight. And we've got some wonderful things, so I'm glad you're here to join us. We are very grateful for these 4 board members who have all served for many years and been a great part of the Academy and provided great leadership. Dr. Dan Chappell has been a board member for 6 years, and for 3 of those years served as our treasurer and did a wonderful job. Dr. Darlene Peterson has also been a board member for 6 years and served as the president of the Academy from 2016 to 2017. Brent Pugh has been a wonderful member and contributed a lot for the past 6 years. And Dr. Sarah Woolsey has very prominently helped out the Academy in many ways, but she has served on the board for the last 10 years, was president from 2014 to 2016, and is also participated as both a delegate and an alternate delegate from the UAFP to the National Congress of Delegates. So a big thank you to all of them.
I am really excited to be able to give the award to our UAFP 2020 Advocate of the Year. This year's recipient is Representative Suzanne Harrison, MD, also, so Representative Doctor, we like to call her. I'm really lucky to work with Suzanne. One of my roles is as the UAFP lobbyist on the Hill, and she is just one of the strongest advocates in general, let alone advocates for healthcare. So I'm very thrilled that we're giving the award to her. She's an anesthesiologist at Riverton Hospital. She also represents District 32, which includes Sandy, Draper, and White City in the Utah State House of Representatives. She's a mom to 3 kids, age 16, 14, and 12. She completed her residency at Beth Israel Deaconess Hospital, received her MD from the University of Utah Medical School, and completed her undergraduate studies at Stanford University. She is a past president of the Salt Lake County Medical Society and past chair of the Department of Anesthesiology at Riverton Hospital. So join me in watching this short video.
I'm so excited that the Utah Academy of Family Physicians has selected Representative Suzanne Harrison for its Advocate of the Year award. And I don't know anybody at the legislature that works harder than Representative Harrison on really seeking out those meaningful bills that help everyday Utahns, that help families. And I think that if we have more policies and more legislators like Representative Harrison, then our state will be better off for it. We will have a healthier, more vibrant community, and we will survive this crisis that we're in right now if we continue to look to Representative Harrison as a thought leader and an opinion leader, as an expert, a medical expert, but also as a mom and a wife and a neighbor, and somebody who has kids in public schools and really gets how central good health is to the human and economic vibrancy of our state.
There's always energy at the Capitol, but there's often a lot of negative energy at the Capitol. And Suzanne just brings a powerful rush of positive energy wherever she goes. She's working on important projects. She's making friends with whoever she needs to work on those projects. She's courteous to everybody all the time and giving them positive reinforcement and letting them know a thing that makes them feel good about what they're working on. Just everywhere she goes, she's working on important projects. And even when she's not the one working on the project, for example, with COVID-19 and the hydroxychloroquine and the different contracts that the state has been involved in, she's paying attention and having something important to say and bringing a level of medical expertise to the discussion that is her own expertise, and going out of the way to find other medical expertise and get it into the discussion. So she's the one who goes out of the way to get the infectious disease doctors, to get those who have expertise in the lab science, and make sure that their voices are also heard in the discussions as the state tries to make decisions, in this case about COVID-19, but about all the different things. She's just brought a bunch of positive new energy to the discussions that surround medical issues, primary care issues, but all medical issues at the Capitol, and she's a perfect recipient for the award.
And I'm so excited that Representative Harrison is getting this award because she's been such an incredible voice for public health, for healthcare access, and as an advocate for kids and families at Voices for Utah Children, I feel like Representative Harrison has done so much to help elevate kids and families' access to care and healthcare coverage up on the Hill. And she really listens to advocates. She listens to everyone. And it's been so wonderful to be able to work with her. And I feel like she just listens to people and understands the issues and gets to the heart of the issues in a really incredible way. And I've just felt very lucky and fortunate to be able to work with her and to have her as one of the representatives that are speaking for kids and families.
I'm the advocacy director for AARP Utah, and AARP represents over 38 million members age 50 plus across the country and more than 226,000 here in Utah. And we regularly hear from our members that access to affordable health care is one of their top concerns. And I've always appreciated that Representative Harrison was willing to lend her expertise and her talents to work on these important issues to our members, as she's proposed important legislation that impacts the way that they live their daily lives. I've been very impressed with her ability to work across the aisle with all of her colleagues to get the work done. I think that's been one of the most impressive things I've seen with Representative Harrison, is that she is focused on the solutions and is willing to do what it takes to get the solutions in place, rather than trying to take a position and it's her way or the highway. I was very happy to hear Representative Harrison was receiving this award. She is very deserving of it. I look forward to working with her more in the future, and look forward to seeing the success that she can continue to bring to making healthcare more accessible and more affordable in our state.
I think Suzanne Harrison is the ideal candidate to receive the Advocate of the Year award. When we look at this and we analyze who we might give this to, we look at someone who's a really strong advocate for healthcare. But in Suzanne, we find someone who also is a healthcare professional. And when you couple those things together, you get just incredibly sound policy decisions. She is someone who does everything with a great deal of integrity. It's really critical when you're working on healthcare policy to have someone who actually understands healthcare. And so often when you are in a committee meeting at the legislature, you're sitting across from real estate developers and people who have no experience whatsoever in healthcare. And they're doing their best to understand it. But then when you can have someone like Suzanne Harrison, who is not just a representative, but also a doctor, who can explain things to her colleagues, who can articulate things in a way, and she's one of those that can take a really complex issue and digest it down into some really understandable terms and allows them to better understand what it is that they're voting on. And she just engenders trust. And again, it's that authentic quality that she brings to everything. So I'm really excited to give this award to her this year, and I think there's just no one more deserving. And with that, we'd like to welcome UAFP's 2020 Advocate of the Year, Representative Suzanne Harrison.
Thank you so much for having me, and thank you for honoring with this award. I hadn't seen that video before. That was very touching, and I just am very grateful for your consideration and recognition of the work that I'm trying to do. And I'm also honored to serve with every person that was in that video, whether they're elected colleagues or advocates. We have amazing people working to improve the health of Utahns, and the Utah Academy of Family Physicians is one of the top on that list of people really, and organizations really working to improve the health and well-being of Utahns. So thank you. This means a great deal to me. I just want to give a special shout out to Dr. Jones. Thank you for your leadership and the capacity that you're serving. And I've had the opportunity this term to work with Dr. Woolsey extensively on some legislation, and also with Marianne Martindale, your astute and very competent executive director. And I appreciate working with both of them. And just appreciate the work that you do. More than any other group of specialists, you're really at the forefront of advocating for policy that helps Utah families, and your presence and contributions to improving policy as family physicians is critical, and it does end up significantly improving legislation, and also bringing legislation to the table that perhaps otherwise would not have been brought forward. So thank you for your work. I especially now in the middle of an unprecedented pandemic, we need you and your voice now more than ever. And I look forward to working with you, and reach out anytime to me if there's issues that I need to know about, so that I can be an advocate for the health and well-being of the Utahns in our communities that so desperately need advocates. So thank you again. I'm really honored, and I look forward to continued work with you to improve our state.
And now Isaac.
Yeah, thank you so much, Suzanne. For those of you I haven't had a chance to meet, my name is Isaac Noyes. I'm a family practice hospitalist in Salt Lake City, and I've been a board member since my residency days in 2014, I think it is. I'm also the incoming president, as you will watch me stumble through a recited thing later on in a few minutes here. As it pertains to right now, every year we take a moment to honor and recognize an outstanding family physician in our Utah community. This year I have the pleasure of proudly awarding our UAFP Physician of the Year to a colleague of mine, Dr. Cami Collette. She was raised in Colorado in a medical family. Her father was a pediatrician who cared for kids with special needs, and her mother was a hospice nurse. She came to Utah in 1975 to go to Westminster College, and she attended the University of Utah Medical School, completing a family medicine specialty training at the University of Utah and Holy Cross Hospital thereafter. She joined the faculty at the Department of Family Medicine in 1986, the year I was born, I'll mention, just because I know that'll get a laugh out of her. And developed actually a new family practice residency in the early 1990s, which I actually attended. So hopefully that brings that around full circle, which I just really love. And that's based at St. Mark's Hospital in Salt Lake. She's cared for patients in the Valley for 34 years and continues to see patients in both the clinic and the hospital setting. She's also active outside of the hospital setting. In 2016, she returned to Westminster College and completed her Master's of Public Health in May of 2018. She's on the National Post.org committee and the chairman of the Utah Post Registry Committee. Those are groups active and working towards provider order for life-sustaining treatment and allowing patients to have dignity at the end of life. She's been extremely active and vocal on this regard. She's done presentations on advanced care planning, both locally, nationally, in order to help patients prepare for care in times of medical emergencies. In September 2017, even, she was honored as a healthcare educator hero by the Utah Business Association. So she's widely recognized in our community, even outside of just the local medical community, and you can't say enough about her. On the personal side, she's also a devoted family member. Her husband of 38 years recently retired from being a physics professor at Westminster. Her 33-year-old son has completed a master's degree and lives with his wife, Holly, in Brooklyn. She loves spending time with her family, enjoys activities like singing, gardening, hiking, swimming, skiing, and bicycling, and doing all of the Utah activities that we all hopefully get the chance to partake in. And I'm promised now we have a chance to view her video in celebration of Dr. Collette.
So I'm Lyman Woolens. I am a third-year resident at St. Mark's Family Medicine Residency. I first met Dr. Collette back in 2018. I met her actually skiing on our ski day interview at Brighton. You know, to have somebody out there who was, pushing everyone's skills, even though, she was twice our age, was really, really cool to see and inspiring to see. She was one of the major reasons why Carly and I kind of fell in love with the St. Mark's program. She was so welcoming to us and, is somebody who lives to make others feel better and to boost the confidence of others around her.
Cami is a relentless teacher across the board. And relentless in a good way. Every way that she interacts in terms of talking to families, looking at the patient as a whole in terms of their life goals, their overall health, their emotional and physical health. Dr. Collette is adamant about all of her students learning to care for patients the way that she's devoted her life to care for patients. So I don't want to throw her under the bus for the number of years that I think that she's been teaching and practicing in the Salt Lake Valley, but it's a long time and it's been across a lot of different venues. She's taught, probably hundreds of residents and medical students along the way, from, like I said, working at Planned Parenthood, to teaching residents, to taking care of her patients, to working on end-of-life care and advanced directive stuff at the state as she was working through her MPH. Even just in the last 5 years, as she's taken on more degrees and more schooling and everything, she has just devoted her life to being a full spectrum family practice physician in this community, and I can't think of anyone else more deserving to have this honor.
I know Cammie through a few different venues. So first of all, Cammie definitely served as a mentor to me and also to my husband, who's a family physician. When we were med students and residents, she was always an enthusiastic supporter of family medicine, but really encouraging students and residents to really appreciate family medicine, appreciate medicine, and have excitement and enthusiasm for it. And then I also have had kind of a second long relationship with Cammie in the Utah Medical Association in the women's physician section. I was able to be co-president with her for a few years, and she's been one of the co-presidents for I think over 10 years now, and has really helped lead that section of the UMA. And Cammie is so happy and comes across as being very sweet, but she's also tough. And she was always right on top of standing up for the needs of the women in the Utah Medical Association and really helping to support our section to move forward. And she's always got great ideas to help enrich the women's physician section in the UMA and just continue to really uplift women, I think, in medicine in general. And also she is, of course, a great advocate for family medicine as well. And I really look up to her and appreciate all her, like I said this a few times, but enthusiasm would be the one word I'd say to describe Cammie, and her passion for sure. So she's definitely deserving of this award.
I'm Carly Willens. I work with Dr. Cammie Collette at St. Mark's Valley Medicine. I have the pleasure of and the honor really of having her as my advisor during residency. I have learned so much from Dr. Collette. I think the biggest thing I learned from her is just how to invest and get to know your patients. I mean, her patients look at her like she's part of the family, basically. She knows mom, dad, kids, dogs' names of almost all of our patients, and she remembers all of them. I think one of the things I admire most about her is she'll remember back to the early 2000s or 90s when she rounded on her patients at a hospital that she doesn't even have privileges at, just to go say hi and do social visits. And when she knows they're in the hospital, she goes to say hi, she goes to figure out how they're doing, and she really, really involves herself in her patients' lives. I think that's the beautiful thing about Cammie Collette being Family Physician of the Year. She totally deserves this award, and I'm really excited for her and excited for another year learning from her.
Cammie has been my doctor since I was 12 years old when I moved to Salt Lake at a really challenging time in my life when I was transitioning from living with my mother to living with my aunt. My first memories and experience with her really have to do with what an excellent listener that she is and the incredible energy and warmth that she brings to her practice. Over the years, I have followed her from clinic to clinic. In my professional life, I work in the arts and culture sector, and I've always focused on the intersection of social and cultural issues. And I have a background in education too, so it's been really the cherry on top that Cammie works with students in residency programs and also focuses on clinics that serve refugee and immigrant populations. So it's no surprise to me that she got this award, and I've just been so incredibly impressed with her continuing education in her life, and I just can't imagine finding an adequate replacement for her one day, and I can't even think about her retirement, but she's been such an incredible confidant, backup mental health therapist, sound advice giver, and is so compassionate and caring and gleeful. And I just adore her so much. So congratulations, Dr. Collette, and thank you so much.
Very amazing presentation, and we'd like to have Cami say a few quick words about receiving this award. Thank you, Cami, for everything.
Oh, this is such an honor to be honored by the Utah Academy of Family Physicians, an organization I cherish. The ability to be able to teach residents and also patients, but I learn so much from the residents and my patients. They teach me every day. I just got this special delivery today. I don't know, was delivered at my doorstep. So thank you. I couldn't have done this. I mean, I do think my parents were amazing. My father introduced me to a female pediatrician when I was 5. I was hoping to be a nurse like my mom, and then realized it wasn't illegal for women to be physicians. It was like eye-opening. And of course, I am married to the absolute best husband in the world. My husband, Peter, he has put up with so much over the years. I met him in 1977, and that is amazing to have my best friend as my husband. And my son is just amazing. I get speechless when I think about all this. I think that it was wonderful to be able to go back to school at Westminster College, and so many of you were involved with helping me along the way. Yes, Sarah Wilsey, thank you very much for being my I think that one of the things you should never stop learning. I think that's one of the things to learn. Never stop asking questions, and just never forget that, you know, our medicine, we are blessed with being able to take care of patients and their families, and it's a blend of art of caring as well as the discipline of science. And I think it just allows the richness of making that human connection. I thank you so much for this wonderful award.
Thank you so much, Cami. You are so deserving. And I have actually about 35 minutes of video that I'm going to find a way to get to you. I had to take 35 minutes and cut it down to 6 minutes. So people had a lot to say about you and probably would have said much more. So I'll find a way to get all that video to you. Thank you and congratulations again. And next we're going to actually introduce Sarah Woolsey. She is with Comagine, and they were generous sponsors of our poster session that we recently held. And we had some great contestants. We took it from, it was supposed to be live back in May 15th when we were originally going to do the annual meeting. And then we had to pivot, my favorite word of 2020. We pivoted to a virtual version last week. We had some great presentations. It was very difficult to choose between them for the judges, I understand. And Sarah was able to join us for that. And now she's going to tell you who the winners are.
Thank you, you guys. Hey, I'm hailing from a halfway across the country trip to see my mom in Illinois. So we're driving, and I'm in Kurt Gowdy State Park in my car, and I'm really honored to be here. And yeah, the poster presentation, Barb, you put on a great show, and we had great presenters, and again, well-deserving awards. So just Comagine Health, we are the quality improvement organization for the state. You may hear about us because we are committed to bringing value and quality for Medicare beneficiaries. And so I get to work with lots of different kinds of providers, and we have sponsored the Quality Award for a number of years because we're excited to have, you know, family medicine be part of advancing the science of everything in healthcare. And you'll see the variety of presentations that went this year were amazing. And I'm excited to see what futures come from these residents and students. All right, so you guys, the poster session folks, they pivoted to doing these presentations from various settings. And I'm excited to honorably mention so Raquel Reisinger and Carl Heward, they talked about the impact of medical school elective health behaviors pathway. They're really looking at the impact of a intensive nutritional training, nutrition and lifestyle related training in med school, and they're going to advance how we train medical students in these particular areas that are so important to patients' futures and health. So I'm excited to see what happens with them. Also, the drivers of rural health in the U.S. and Africa, Winston Pluckett, he is committed to looking at what has you want to be a family physician in both places like Africa and the United States and comparing those. Very interesting presentation from him. For the third place, next slide, we had the evaluation of the likelihood of specific Press Ganey outpatient medical practice survey questions to receive a perfect score. Andrew Stevens did some really important work about how physicians are graded and ultimately paid by organizations such as CMS. And it's really important to look at what do these measurements mean and what do they really mean for the quality delivery of care and the kind of things that matter to patients and ultimately to government organizations, and he's going to impact that field. Thank you, Andrew. Second place goes to our awesome students from St. George, our newest medical school. So really awesome video and in-person presentation creatively done by Marcus Oliver, Aaron Rieger, and Ben Robbins, looking at what happens to medical students as they go through a very intensive change first, second, third years. And we're going to hear more from this group as they continue to study the habits of med students. They've really advanced this from just a small project to really looking at the impacts of medical school on health. So I can't wait to see again what happens with these guys in the future. First place goes to Prepare for Your Future, Harnessing Popular Education to Empower Latinx on Infectious Disease Prevention. Jason Chen is doing both MD and MPH and really took advantage of his, I believe, internship to do some very important work around HIV education, around STD prevention for Latinx folks in our community. And in Salt Lake City, I did not know that community is disproportionately affected by new diagnoses of HIV. And so looking for ways to do this, Jason is fluent in at least 3 languages, including Spanish, and was able to develop and implement and measure the effect on this education. So well-deserved by Jason. Thank you for your presentation. And again, thank you for the Academy for having this session and just really showcase the importance of what family physicians contribute to science and to quality improvement. So thanks, you guys. Good job.
And just so you know, all of those presentations, if you'd like to view those, are available on our website, and we will have the link. The link is on the screen right now, but it'll be easily found on our website. Now we would like to welcome Dr. Ben Wild from Rocky Vista University.
Hi, everybody. It's good to meet you. I just want to first start by thanking you for the warm welcome you've given our students at RVU. It's always strange when someone new moves into town, and we moved into the state, and our students and our faculty have both been just welcomed with open arms. I chair the Department of Primary Care on the Utah campus, and I also have the opportunity to act as advisor for the family medicine interest group on campus called the Student Association of the American College of Osteopathic Family Physicians. The reason I've been invited to provide a report is to let you know how our students have really hit the ground running. We've only been on, we've got 3 classes in now, and they have really done an excellent job of really promoting family medicine in the best way possible. The AAFP recognized 18 universities, medical schools this year as programs of excellence. And this award is given to those student interest groups that have exemplary efforts in growing and supporting interest in family medicine. And so our students this year and in the last couple of years have created a monthly clinical skills workshop series that just really drew on diverse topics that captured students' interest and secured their involvement, and really brought in elements that there's just not room for in the typical curriculum. And so some of the things they covered included a suture clinic, the osteopathic manipulative techniques in pregnancy, EKG reading, acupuncture, and traditional Chinese medicine, conversations on vaccines, and a simulation in vaginal delivery, and a simulation in postpartum hemorrhage and neonatal resuscitation, just to name a few of the many that they've done. We're thrilled with the outcomes and the interest that this has driven around family medicine, and honored for them to have received such a recognition from the AAFP. We do have current Student Association President Nick Longi here with us attending. Nick, do you have anything you want to add to what I've said?
We were just thrilled by the turnout that we were able to get and the interest that we were able to spark in family medicine through these many varied activities that we were able to explore through our club. So we were so excited about the opportunity and just honored by this recognition.
My name's Chad Spain. I am the past treasurer of the Utah Academy and incoming president-elect, and I am here today to introduce our 5 new board members. So we'll start with Dr. Craig Beatty. Dr. Beatty works in family medicine in Vernal, Utah at Ashley Regional Medical Center. He has worked there for the past year since finishing his residency at Utah Valley Family Medicine Residency. He, along with his wife and 3 children, loves small town living and the life that rural medicine provides. Dr. Beatty has a passion for healthcare advocacy. He served as delegate at the UMA Congress of Delegates in 2019. He also worked with the Arizona chapter of the Academy of Family Physicians during medical school, where he served as student representative on that board. Welcome, Dr. Beatty. Next is Dr. Marlon Christiansen. Dr. Christiansen was born in Gainesville, Florida. He graduated from the University of Utah School of Medicine and completed his family medicine internship and residency at Naval Hospital Camp Pendleton, California in 1997, and maternal fetal medicine fellowship for family physicians in 1999 and 2000 at Florida Hospital in Orlando. He spent 11 years as a physician with the Navy, stationed in Guam, San Diego, and Naples, Italy. For the past 14 years, he has been faculty at Utah Valley Family Medicine Residency and continues to practice full-scope medicine, including obstetrics and hospital care. Welcome, Dr. Christiansen. Next up is Dr. Tiffany Ho, MPH. Dr. Ho joined as faculty at the University of Utah Family Medicine Residency about a year ago. Prior to that, she completed her training at Swedish Cherry Hill Family Medicine Residency in sunny Seattle, Washington. She's very passionate about providing full-spectrum family medicine, thus is the only faculty who still does obstetrics, attends inpatient, and does outpatient at Sugar House Clinic in Salt Lake City. She has a special interest in increasing students choosing family medicine, women's health, mental health, and substance abuse. So welcome, Dr. Ho. Next is Dr. Miner. Dr. David Miner was raised in Ogden, Utah. The importance of education was emphasized in Dr. Miner's home, and he determined at a young age that he wanted to become a physician. He graduated from the University of Utah School of Medicine and completed his residency in family practice at the University of Illinois in Peoria, Illinois. Dr. Miner was a family physician with Intermountain Healthcare for 18 years in Taylorsville, Utah. Since June of 2018, Dr. Miner has been the first full-time medical director of the Maliheh Free Clinic, where he works to help end the cycle of poverty and suffering created by poor health by providing high-quality, free medical care to low-income, uninsured Utah families. Jose Rodriguez, Dr. Jose Rodriguez, and fellow of the American Academy of Family Physicians, serves as Associate Vice President for Health Equity, Diversity, and Inclusion at University of Utah Health. Dr. Rodriguez is a professor in the Department of Family Preventive Medicine, has extensive background in diversity work in the healthcare arena. In addition to his health equity, diversity, and inclusion position, he is a family physician and associate medical director at University of Utah's Health Redwood Center. I'd like to welcome all 5 of these fantastic physicians to our board, and congratulations. And Kyle, over to you.
Welcome to all of you. We are very grateful to have you as part of our board. We are extremely lucky that we have Dr. Ada Stewart joining us this evening. She is currently the president-elect of the American Academy of Family Physicians. Just a little bit about her is she is originally from Cleveland, Ohio, went to medical school at the Medical College of Ohio, and then completed her family medicine residency in Columbia, South Carolina. And she currently practices there in Columbia at Cooperative Health, where she is the lead provider and an HIV specialist. She has served in multiple leadership positions, both in the National Academy, but also in the South Carolina chapter of the Academy, including being a former president of the South Carolina chapter. She is also a member of the American Academy of HIV Medicine, the American Academy of Hospice and Palliative Medicine, the National Medical Association, and the American Medical Women's Association. She began her career as a National Health Service Corps scholar, caring for underserved patients in rural South Carolina, and she continues to work with underserved communities in both rural and urban settings. After September 11th, 2001, she enlisted in the U.S. Army Reserves and has achieved the rank of colonel. And she was recently named to the Presidential Advisory Council on HIV and AIDS. That's just a few of the wonderful accomplishments that she's done, but we will turn the time over to her.
Thank you so very much. And I have a few slides I'll have put up there. Okay, awesome. So greetings from the American Academy of Family Physicians. It's both an honor and a privilege to be able to be with you all tonight. Sadly, it's virtual. I would definitely have preferred to be there in person. But on behalf of the National Academy and from the bottom of my heart, I want to thank each and every one of you all for what you do for your patients, for your families, for your communities, and for the specialty of family medicine. Next slide. Who knew? Who knew that we would be hit with a pandemic that unveiled the flawed healthcare system that rewards fee-for-service? Who knew that this pandemic would unveil the health disparities that continue to plague our nation? Next slide. Who knew that we would see the death of Black individuals at the hands of police that would spark the entire world to protest? And who knew that we would see the true impact of systemic racism that exists in our own healthcare system? Who could have imagined that we would be here today amidst two crises, that of the coronavirus pandemic and that of systemic racism? Next slide. The specialty of family medicine has shown its value that throughout these crises, we have been able to fill many roles. Family physicians have worked in the ERs, the ORs, the ICUs, urgent cares, and outpatient practices. We saw that no other specialty can do what we do. We have shown how flexible, adaptable, and sadly, how vulnerable our specialty is. Unfortunately, we have lost many of our colleagues, many more than any other specialty. And this has mostly been contributed to the lack of proper PPE. And in addition, many have had to close their doors, furloughed staff, or themselves endured being furloughed. Some have decided to retire early. We have seen the impact of this pandemic have on medical education, impacting our students and residents. This pandemic has impacted everyone. Even here in Utah, and I wish I was there with you all. Since the pandemic began, over 50,000 individuals have been diagnosed with COVID-19, and over 400 have died. It has been said that one should not let any crisis go to waste. Your academy will not let these crises go to waste. Next slide. Your academy continues to hear you and continues to fight for you, your patients and communities in the specialty of family medicine. Only this week, we announced a collaboration with a not-for-profit organization, Project N95. This is part of the Academy's ongoing work to empower family physicians to continue their work as a foundation of America's healthcare during this COVID-19 pandemic. This member-only benefit provides the opportunity to purchase items such as N95 masks, gowns, and face shields in small quantities beginning this week. And this actually started August 24th. It will continue until September 2nd. This opportunity is also available for our students and our residents. Your academy continues to be your go-to resource in regards to COVID-19. Some of the resources that we have had is our dedicated page to COVID-19, our rapid response member exchange digest, our wonderful town halls with our esteemed president, Dr. Gary Leroy, and other educational opportunities. We have also provided live CME programs. Although we have not been able to be there in Washington, D.C., as the picture there shows, we continue to fight and advocate in Washington. Your academy is calling on Congress to dedicate $20 billion of provider relief funding to primary care physicians in all practice settings. We continue to fight for the extension of the Payment Protection Program and for increased payment to Medicaid providers. Next slide. We also advocated with other medical specialty organizations to improve and help implement telehealth services. The importance of telehealth was definitely seen as we saw our practices falter under the current fee-for-service system, where the number of in-person visits severely suffered. We will continue to fight for the flexibility afforded in the CARES Act during this pandemic while discouraging fragmentation of care. Next slide. We are still advocating in DC to support and sustain primary care and for payment reform, emphasizing that we must have a value-based system built on the foundation of primary care, specifically family medicine. We will be your resource as you navigate the proposed changes to the Medicare physician fee service schedule that will take place January 2021. Your academy continues to provide resources that family physicians need to not only survive, but thrive. This includes embracing and implementing technology. And of course, we continue to address administrative complexity, the #1 priority of our members. Next slide. We advocate loudly for our most marginalized patients, including those with limited English proficiency, those with disabilities, and of course, people of color. It was in that spirit that we issued a bold statement on May 31st, 2020, attributed to our president, Dr. Gary Leroy, condemning racism in all its forms and declaring it a public health emergency. We continue to be the leaders in dismantling racism with policy that come from our COD and with the work of our Center for Health Equity and Diversity. With the development of the Everyone Project and our implicit bias training, our center has led the way as we look to address health equity. And starting in 2021, all board members and those in position of leadership within the AAFP will be required to participate in annual anti-racism training. This will help equip us to lead the journey to becoming an anti-racist and multicultural organization. Next slide. On August 17th, we proudly launched our new, improved website and app. Hopefully you all will have the opportunity to view that. Next slide. Last but not least, I want to express our excitement as we welcome Mr. Sean Martin as our new EVP CEO. You know, we are forever grateful to Dr. Doug Henley for his over 20 years of friendship, dedication, and commitment to our academy. But we look forward to our future under the guide of Mr. Martin. Next slide. You know, the pandemic has truly created unprecedented times. Just as we are here meeting today virtually, our COD and FMX has had to move to a virtual format. And in October, we will have our first virtual COD FMX. Next slide. And I ask that you all please join us as we have to meet under these extenuating circumstances. And I want you all to know that family and pets will be welcome. So in closing, we will not have the opportunity to meet in person and realize that we really have to make sure that we do not let these crises go to waste. The specialty of family medicine has shown its value. No other specialty can do what we do. And again, I want to thank you all from the bottom of my heart for your commitment and dedication to the specialty. Remember to love each other, to care for each other during these trying times. I love you all, and we'll get through this better and stronger. Remember, we cannot let these crises go to waste. Stay safe, stay strong, stay well. Thank you, and God bless you. Now, I have the honor of installing Dr. Isaac J. Noyes as the new president of the Utah Academy of Family Physicians. Dr. Noyes, the membership of the Utah Academy of Family Physicians has chosen you for the role of president in recognition of your dedication, vision, and leadership. Effective leadership can seem complicated. It often involves walking a fine line between enabling and dictating. Individually, we all seek the right combination to allow us to lead without overwhelming. Our specialty cultivates individual leadership. By virtue of the demands of our specialty, we are comfortable taking on more than most people. We are family physicians. because we want to make a difference in the lives of our patients, their families, and our communities. The Utah Academy of Family Physicians, the Academy, and your peers have placed great trust in you as their leader. I salute your energy, your commitment, and integrity. Please raise your right hand and repeat after me. As president of the Utah Academy of Family Physicians,
as president of the Utah Academy of Family Physicians,
I recognize the trust my peers have placed in me.
I recognize the trust my peers have placed in me.
By electing me to this position.
By electing me to this position.
I am committed to serve the specialty.
I'm committed to serve the specialty
of family medicine, the state and national academies.
Of family medicine, the state and national academies.
And our members and patients with professionalism and creativity.
And our members and patients with professionalism and creativity.
I resolve to honor this trust and commitment.
I resolve to honor this trust and commitment.
By devoting myself to upholding and maintaining.
By devoting myself to upholding and maintaining.
The dignity and official responsibilities of my elected office.
The dignity and official responsibilities of my elected office.
Please welcome Dr. Isaac J. Knowles, your duly installed president of the Utah Academy of Family Physicians. Congratulations.
Thank you.
I would like to install, I'm sorry. I would like to confer the degree of fellow. The degree of fellow was established in 1971 by the Congress of Delegates as an avenue for special recognition for those of the UAFP who have distinguished themselves amongst their colleagues, as well as their communities, by their service to family medicine, the advancement of healthcare to the American people, and by their professional development through medical education and research. As a fellow of the American Academy of Family Physicians, these distinguished individuals are entitled to all the privileges, ceremony, and honor bestowed by this degree. The 2020 AAFP Fellows from the Utah Academy of Family Physicians are Dr. Dylan Cole, Dr. Gary McDonald, Dr. Mikuo Obeasi. I hope I did not do that too much harm. I apologize. Dr. Chad Spain and Dr. Ben Wild. Please recite the Pledge of Fellowship after me. As a fellow of the American Academy of Family Physicians, I promise to dedicate myself
as a fellow of the American Academy of Family Physicians. I promise to dedicate myself
to the principles upon which our academy was founded.
To the principles upon which the academy was founded.
To providing comprehensive lifelong care to my patients.
To providing comprehensive lifelong care to my patients.
To exemplifying the highest traditions of my profession and
to exemplifying the highest traditions of my profession and
to enhancing my professional skills through continuing medical education.
To enhancing my professional skills through continuing medical education.
I pledge my commitment to improving the health of my patients.
I pledge my commitment to improving the health of my patients,
their families and communities,
their families and communities,
and 2, advancing the specialty of family medicine.
Into advancing the specialty of family medicine.
Now and in the future.
Now and in the future.
In accordance with the bylaws of the American Academy of Family Physicians, I hereby confer upon you all the degree of fellow. Congratulations.
All right. Thank you so much, Dr. Stewart.
Thank you.
Yeah, of course. Thanks for joining us. As we're just only a few minutes late on the agenda, it's probably time to bring the meeting to a close. I want to thank everyone for taking the time out of a busy day to end your week with us. And again, I wanted to express my thankfulness and appreciation for everyone that was acknowledged tonight, from our Advocate of the Year, Physician of the Year, all of our new fellows, etc. So thanks again. It's a very unique yearly meeting, so I appreciate everyone bearing with us. As we close, Barb was going to show us a few events coming up that we wanted to share with everyone in the Academy that hopefully you can spread the word about. 2 things in particular. We have the Ask Me Anything About COVID forum. It's an online forum that actually has a really great panel of speakers, including Representative Harrison and Dr. Ward. Dr. Pavia and Lo Pansori, who's one of the leading ID physicians in the Valley, and Dr. Rodriguez joining to answer questions. This is open to the public, general audience, so please share it with friends, family, patients. Hopefully this is going to be a really good thing for the Utah community. And let's see, Barb, what else do we have? Women's Health Virtual Live CME is going to be coming up November 7th. We're not planning on doing our big CME in Park City, obviously, for travel and large group setting meetings, but hopefully this will tide you over to next year with another great lineup of education on the 7th. So please sign up for that if anyone's interested. We look forward to seeing everyone in person, ideally next year. So be safe, be well, and thanks everyone again.